Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Well, trauma-informed care is something that's been bantered about more and more and more in our community. And here to tell us more about what that is our trauma-informed care community coordinator, Lacie Ketelhut. Thanks for joining us.
Thank you for having me.
So first of all, we have to start off, what is trauma-informed care? Now, we had this on this very radio program not too long ago, so I want you to kind of, give us what trauma-informed care is, but I also want to give us a little update as to where we're at and where we're heading.
Mm-hmm. So trauma-informed care is an approach. It recognizes the signs and symptoms of childhood trauma and the role that trauma has played in somebody's life, whether that's a child or an adult. And it also looks at the opportunity for recovery and healing from those experiences.
I think one of the words you've used is there's resilience, and then there's impact over the life of an individual and how it impacts their health. Mm-hmm. Talk about both.
So childhood trauma, another term that you'll hear, there's a lot of terminology, is adverse childhood experiences. And really what we know from that is that what happens to you in childhood and the experiences that you have impact your adult health. So having traumatic experiences in childhood will influence and put you at a greater risk for health, physical health problems, mental health problems, social problems, and the list could go on.
Interesting. Can you give us an example of what an adverse childhood trauma might be? And I know that's really hard to answer because it can be different and so individualized.
So adverse childhood experience, number one, they're really common. We know about 2/3 of the population has experienced at least one of these.
2/3. That's a high number.
Mm-hmm.
Okay.
That's from the original study, which continues to hold true as studies continue to be replicated, that we know they're common. They happen in our population and in our community. And there's 10 original that are in the original ACE study, but they look at experiences such as abuse, physical abuse, emotional neglect, household functioning or household challenges, such as a divorce, separation, incarceration, living with a parent who has a mental health problem or an abuse problem with substance. Those are some very specific things. What they really are is they're experiences that a child experiences that really overwhelms the child's ability to cope. And they happen without the presence of that safe, stable, nurturing adult. And when we get those factors together, that is what we consider an adverse childhood experiences. And that's what starts to increase the risk for those later health problems.
All right. You mentioned, quite a long list there, but that's just a small sample of what could be considered an adverse childhood experience.
There's other things. So the original ACE study has kind of 10 that we look at, 3 categories of abuse, neglect, and household dysfunction. But there are other things. Things such as community violence has been considered. It's really an event or an experience or a set of circumstances that does that really stressful experience that overwhelms that body to cope with it for the child.
Recently, I know that there's been a lot of news coverage over the kids in Thailand who were trapped inside a cave for multiple days, mm-hmm. all rescued. But I know in talking with some folks in healthcare, they're saying those 12 kids, watching them over time, some of them will have long-term health effects because of that. And you're talking about physical health effects, but maybe mental health effects too because of that experience.
Yeah, you bring up a really good point in mentioning the relevant story that we're all hearing in today's news.
The kids in Thailand.
Yeah. What's the difference between a difficult life experience, such as that, and an adverse childhood experience? And while you can have that difficulty in that, and could you have increased risk for mental health struggles and challenges later on from that experience? Yes. But if you have safe, stable, and supportive adults around you after a difficult experience has happened in childhood, that's what we really see fosters resilience and helps children to overcome those experiences, as well as do you have the right supports in place? And it sounds like those children are getting attention and having some of those supports.
And it doesn't always have to be a parent that is providing that support. And that's kind of the idea behind the community and your role mm-hmm. of engaging the community on this topic.
Mm-hmm. Community awareness. It starts with, we're at least having the discussion right now. Childhood trauma has been around a lot longer than the original ACE study, which first came out in 1998. So we're having the conversation. We're recognizing, and we now understand better than we ever have before, how childhood trauma really disrupts a healthy child development, as well as it challenges to look at health across the entire lifespan. And what does that mean? And then how do we do healthcare as a healthcare system? And as a community, how do we foster healthy kids and resilient families in this community?
Kind of an interesting thing. You mentioned the healthcare aspect of it. Engaging healthcare, Gutterson Health System, whether it's a primary care provider or whether it's other avenues, trying to get the healthcare community more up to date, up to speed on this that's been around since 1998, in and of itself is a challenge.
Mm-hmm. Well, as a healthcare system, think about the work that we do. Really high quality treatment in response to many of the problems and challenges faced in this community. Physical health problems, mental health challenges, the social problems. And we really need to understand what influences those things to happen. So as a healthcare system, we can get ahead of it and help really promote healthy lifestyles in preventing while still being able to respond to them when needed.
Interesting. One of the things that I've heard some people say when they bring this topic up is a lot of times we know that maybe a young boy, grade school, we know that their home life isn't that great. We know that maybe there's alcohol involved or, a verbally abusive situation. The idea here, though, is to present those resources to maybe the teacher, the school, or the community to help that boy, that young boy, overcome and be resilient. And that takes us to the word resilient. Can you talk about that a little bit?
Well, adversity in childhood does not need to represent a lifelong risk factor for these outcomes.
Can you say that again?
Adversity in childhood does not need to represent a lifelong risk factor.
Okay. And that's not been the case. I mean, that has not been the case. So what's being done? How are you getting the community engaged?
Yeah, it's an important message because when you look at the science, it's clear and it's strong. But the science is also clear and strong that the effects of adverse childhood experiences and childhood trauma are not permanent. And that's where the community can get engaged because there's opportunity. You get the question a lot of, so what can I do? It's such a big topic. And the answer is there's a lot that you can do. So as a community, that's what we're looking at. Where can we prevent a child's exposure to these things, to adversity, as well as when we recognize those signs and symptoms, how can we respond in an effective way that reduces risk? So we're looking at resilience factors because those are things that can actually offset the effects of trauma and can reduce that risk, really be a buffer to it. And resilience, how you can describe that is somebody's ability to thrive, adapt, and cope in response to those stressful times. And we want to build that up.
We're talking with Lacie Ketelhut, Trauma-Informed Care Community Coordinator. How do we get over the hump? How do we get the community more engaged?
Our community partners are starting to come. And when I say community partners, all sectors of the community. Childhood trauma is a call to action. It's an all-in
See, a lot of people
topic.
would say it's healthcare, but that's kind of the after effect. What you're trying to say here is we want to get on the front end of this, right?
We want to hit it from all angles.
Good point.
Prevention, that's the best. Here's a childhood trauma, you're not born with it. Adverse childhood experiences. A child experiences childhood trauma. You can prevent that experience. So that's something we're looking at. What are opportunities for that? As well as you can respond to it with those right supports in place. And when those are there, we usually see people heal and recover from it. And then we also want to look at the treatment side. So for those that are still working through and need support for healing and recovery, we want to have the best treatment and supports available.
I know you don't have all the answers, but how do you provide better support as an individual to the neighbor child, to if you're a teacher, to one of the students? How do you put yourself in that situation where you can not overstep, but can provide support? Do we have an answer to that?
Well, when I work with a lot of different professionals in all different sectors, and a great place to start is just look for the opportunities that come in front of you every day. whether you're a teacher or you're a doctor or you're working in the business community. You are working with colleagues, you are having families and children who are walking in front of you all the time, where you can recognize that there's more to this maybe problem, behavior problem, social problem. There's something more here. And when you can recognize that, you're looking at that and understanding the influence of trauma, which changes how you think about that problem. And then it can also allow you to approach it with more compassion, as well as maybe take a different approach that can be more effective in looking at how can I really walk alongside this family and this child, and how can I help foster positive change and also build resilience.
Interesting. Very interesting topic, and it's just sort of the tip of the iceberg right now. This has only been something that's talked about or bantered about in the community for a very short amount of time. A lot of work left to go. All right. Lacie Ketelhut, thanks for joining us. We really appreciate your time, and we look forward to hearing more from you about how you're engaging the community and all the work that's being done. Thank you.
Thank you.